So, Neil,
Joe.
you were telling me that they're coming for the kids. What do you mean by that? Who are they, and what are they going to do to the kids when they get them?
Well, the state is correct in all things, always and forever.
Okay, I agree with that, yeah.
Yeah. The state has decreed that the children should. Is it conditional? I'm not quite sure. Sometimes it sounds like must, but we'll get into that. Be vaccinated against the COVID.
Right.
The state everywhere. Or in many places so
In many
far.
places, yeah. So,
And because they're following the science,
right,
the state knows the science backs the state.
right,
Everyone believes the state
right,
in all things,
right.
naturally.
So, what's wrong with vaccinating children with this vaccine? Don't kids get a load of vaccines?
Exactly, yeah. I mean, many things are mandated
Right.
since, well, a long time.
So why would anybody make a big deal about
Yeah, exactly. What's the big deal?
as I'm asking the questions and you're answering them.
Okay.
No, seriously. Yeah, what's the big deal? Give me a narrative. Give me something.
Well, the COVID is dangerous.
No, give me a narrative. What's the big deal about it? Why should
okay.
anybody have a problem with it? Why would, what do you mean by the coming for your kids? Like that's a negative, that's a pejorative way to describe it. Like when kids get vaccines all the time, this is just one more, right?
Yeah.
So what would be the problem with this one?
The problem is, they say, that the effects of this are unknown.
Right.
There were no long-term trials, which would
Right.
normally happen. Those other vaccines, which are, quote, unquote, mandated for children from infancy in many cases, I mean, within days of birth,
Right.
across the Western world
Right.
anyway, are usually subject to a decade or more of research, animal trials, initial clinical trials on humans, which go back again to the next phase of testing. There are three main phases of testing where I think the first is toxicity effects, the second is
Right.
something else, escapes my mind, and the third finally is efficacy. In other words, the final test, the real test of a vaccine, is taking into account our earlier phases of testing in which we asserted these risks and dangers at these kinds of ranges of risks of probability, therefore affecting this percentage, minuscule or large, whatever, of a population. Given those risks, which we will include on the vaccine insert, we have to by law, is it nevertheless beneficial in terms of efficacy and opening it out to the entire cohort, in other words, the age bracket of children on a nationwide basis, which would in most countries be millions and millions of children.
And is it appropriate to the risk as well, I
Is
suppose?
it appropriate? And at that point, they have the thumbs up or thumbs down.
Right. So, but, well, yeah, I mean, it's a good question, you know, and I think it's part of the narrative, at least for a lot of people, still is that, you know, kids get vaccinated all the time. Many parents have taken their kids to get vaccinated, you know, like you said, from birth and then afterwards, whatever. And I think in France there's something like 11 different vaccines, and in the US it's actually more than that, considerably more than that. But you know, the average kid by the time they're 10 years old or something like that will have like something like, it was like 20 or something, maybe 20. It's some high number.
It's higher in the United States, but yes,
Some high number of
something like
vaccines.
24.
So what's the big deal with this one? The big deal with this one for me is the context in which it's happening. It's happening in the context of the past 18 months of government policies around this disease, this virus, and how they're mandating it, basically, you know, forcing it. I mean, other vaccines are mandated in the sense of, like in France and other countries, kids have to get vaccinated in order to be able to attend school and stuff like this. And so they're trying to just shove this one in alongside it. But I think they're stretching a bit too far. They're pushing a little bit too far in because of the context in which they're doing it. The context, it's not just about a new vaccine for kids. This is in the context of mandating vaccines for adults first and foremost, and then now once they've more or less mandated them by the back door, basically, like saying in different countries you have to have it if you want to enjoy civil liberties. So people are adults have been coerced over the past 6-8 months to get a vaccine, and now that mandating is following on to children. So it's already left a bad taste in many people's mouths in terms of how they've been forced to get a vaccine. And now it's continuing on with kids. And that's why I think people are not happy about kids. First and foremost, anybody who has a bit any more awareness of the situation knows that kids have extremely low risk to this virus, or from this virus. The numbers in the US, for example, are something like, over the whole period, the past 18 months plus,
But
300 children.
Just before you break down,
Yeah, I was just going to say that as a point.
the
Like,
key assumption underlying the whole thing since day one in late February 2020, the key assumption is that the risk of mortality is high
yeah,
from COVID-19.
for adults.
Hence, its official designation by the World Health Organization as a pandemic.
Yeah,
And then later we learned through experience that indeed, when you break it down, it's different. There's a differential.
so there's a
risk.
meme out there. There's a meme in a certain sense around that's spread around the entire global population that this is a deadly pandemic. But
Plague-like.
if you look at the numbers, that doesn't match, doesn't fit, and it definitely doesn't fit with kids. I was just going to say that in the US officially, there's been 300 children have died, quote unquote, from COVID out of 74 million children in the US. That's 0.0005%.
Is that really the absolute number?
Yeah.
300. That's
300.
super low.
Yeah,
Relative to other
but even
diseases.
then, I would even put a question mark over it in the sense that the CDC requires that every child who's admitted to hospital, and I think this has been the case for most of the last 18 months, every child that's admitted to hospital for anything has to have a COVID test. And this is the problem that we've had with the adults as well, going back, that have generated numbers where you have a case-demic, people call it a case-demic, where everybody's being tested, no matter what they go to the hospital or the doctor for. And then those numbers are used, if it comes out positive, those numbers are used as a positive case. Therefore, this person has COVID. They may be at the hospital for something completely different, but they also have COVID because they've been given a test. But just to get an idea of the way they're talking about kids and why people might be a bit annoyed about this, people who, like I said, who are informed. If we just go to our pictures there, Scotty, children, one, for example. Children can get hit hard by COVID. Here's why doctors say kids should be protected. Increased hospitalizations, long COVID, blah, blah, blah. Next one. A good little bit of information there. Infomercial by, I think that's ABC. What to do if your child is exposed to COVID-19 at school? What should you do? Well, you shouldn't freak out for a start, as we'll find. Next one. These are just a few that I picked. Nearly 1 in 4 COVID cases are in children. What that means the school year starts, well, it doesn't mean very much at all, is the thing, although the title is suggestive that it actually means something, but it doesn't really mean anything. And like we said about cases, every child that goes to hospital in the US and in most other European countries, every child who goes to hospital for anything gets a COVID test.
Yeah.
By mandate of
Well,
CDC.
Even that is factually incorrect. Cases is one thing, and
Actual absolute numbers.
look at the descriptor for cases, COVID-19 case. It's not a COVID-19 case. It's a positive or a negative test for
Right.
remnants of SARS-CoV-2.
Right.
COVID-19, as we've said
Is a
1,000
disease.
times,
Well,
is a
that's-
disease with clinical symptoms.
I've given up on that because people just are like, whatever, it's a name. I've given up on complaining about that. I've complained about it. I've complained about it a lot, that people are using the wrong language. There's such a major problem with this whole situation that people are using incorrect language to describe what they mean. They're talking about COVID. I tested positive for COVID. No, you didn't test positive for COVID. Like you just said, COVID is a disease that has, is identifiable by, fairly significant symptoms. For most people, like we say, very mild or whatever. But when people understand, what people understand by have COVID is that people are in a bad way, right? I mean, it strikes terror into people's hearts when they say, I had COVID. So you assume that, let's assume, and it's true, if you have COVID, we should use that definition that you have fairly severe symptoms. You're in bed, you're home, maybe you're even in hospital. Again, the vast majority of people recover, but using that term, I had COVID, when you've tested positive for some remnant of a virus in your system is completely incorrect way to describe it, and it just fuels the hysteria, the misinformation, and the lack of understanding. around this entire situation.
So,
Just
but-
jump on to the next one, Scotty. There's a couple more just
Okay.
to make the point. Studies suggest young children most likely to spread COVID at home to family members. Again, another study that suggests this, that, or the other, blah, blah, blah. But
that could have been a headline from last March,
yeah,
which was the rationale for why you must separate children from their grandparents,
right.
because they acknowledged that the highest risk of severe illness and fatality was in the elderly already by March.
Right.
Hence, we must not
Right.
go and hug grandma.
Right.
Children, keep them away from
Right,
grandma.
exactly. Except that's one study. There are other studies obviously showing that, there's lots of studies showing, and everybody should know at this point, that children literally have about a 1 in a million, depending on their age, 1 in a million or 1 in 3 million risk of being hospitalized or dying from COVID. So it's pretty much the same as the risk of being struck by lightning. The vast majority of them, because of their immune systems, it's well known they've got a very robust kind of primary immune systems because they're young and not decrepit like us. So they basically deal with the virus at the point of entry, wherever they get it. They deal with it very quickly and it's gone. That suggests, and there's studies that show this as well, that they don't transmit it. You look at schools, there's no transmission of the actual of any kind of significant, viral load or whatever in schools to teachers, between pupils and teachers and all that kind of stuff.
Someone needs to tell the American Teachers Union that, because
Well, they've been terrified.
their stance is the exact opposite 2 years in.
Yeah, but they've been terrified into believing that, but it's not actually the case.
Right.
And you can look all this up. There's a wealth of information now. People just do a bit of research to show. Of course, the problem is there's a lot of conflicting studies, and you have to wonder what's going on there. But if you look at studies, they kind of they're never categoric. They're suggestive of this or suggestive of that, and it's based on a small number of people in the study and a particular geographic area and all that kind of stuff. You have to try and you can look at those and use them to inform your position, but your position has to be it has to be ultimately a kind of global position, the overall picture of it, not one specific thing, because that's what people are doing. They'll talk about some outbreak in one place in a country and they won't look at the specific details of who and where and why and what, and they'll freak out and they might lock down that entire country. That's something Australia likes to do, right? They get a little outbreak somewhere up in the freaking bush, up on top of Ayers Rock or something. Some abo got a bit of a cough and the whole country gets locked down or something, kids, basically, my point is that kids, because they're effectively healthy, children are effectively immune to this. It means they don't carry much viral load. It means their transmission of it is extremely low as well. So that whole idea of protect granny by not letting your kids hug them is mostly bogus. Granny or granda who got COVID and maybe died, like we've been saying repeatedly, are the people or people who had a very short
Time left anyway.
time
or
left
something.
to live. They had short life expectancy, basically. The average age. What was the average age of the 95% of deaths? 83 or something.
Well, it
in
was
most
extraordinary
countries.
that it was higher than life expectancy.
Exactly. Yeah. Well, that tells you something. It tells you
It's
that people
just-
are living longer, but not necessarily in good health. You're keeping people who are, who in another era and bygone era would have already died, keeping them alive, but in very poor health. And then a virus like this, or the flu virus, or any other similar virus comes along. They're called dry tinder by government statisticians when they do the numbers every year for, how many people are going to die this year, how many people died this year, how many people should have died. Is it above or below expectations? If it's below expectations, it means that there wasn't much of a viral transmission this winter, so we had a lot less deaths among the elderly. But those people who didn't die this winter because of low viral transmission, they're called dry tinder, because come next winter, they're going. When there's or the next time there's an increase in viral transmission, they're gone. Governments look at people in this cold, calculating, sterile way,
They have to.
and they have done for forever, and yet government spokespeople or government representatives on TV, when they're speaking to the public, like to present themselves as people who have bleeding hearts for every single person who ever got. And people buy it, and most people just don't live in the real world. It's hard to live in the real world because it's not, it's the real world, and it's kind of like, it's not pink fluffy unicorns all the time and stuff. So, and it's for a lot of people that's a bit rough for them to take. They prefer to believe the comfortable narrative. They like to think that their authorities are taking care of them, and that extends from government to medical personnel, etc. And it's just unfortunately not realistic. It's not the way it is. Anyway, is there one more, Scotty? Well, actually, yeah. See, US COVID hospitalization spiked in children, teens this summer. Again, lack of context, lack of data, spiked in teens. How many hospitalizations? And a tiny amount, So this is the scurrilous, disgusting yellow media who like to hystericize, like to sell newspapers, like to get clicks on websites and put up headlines like that. And that's true for every other headline we've just seen. Completely lacking context and tending towards hysterical sensationalism that in many cases totally misrepresents the situation, like that headline.
Okay, so spiked relative to what?
Exactly.
That's the
And
first
how
question
many?
is begged.
Yeah.
But the second question then is, okay, assume there's there's an objective uptick in the data. Is that then the case? You're not suggesting that however marginally small it is, this increase, that they describe as spiked,
Mm-hmm.
is there nevertheless something that has increased?
Possibly.
Specifically here, hospitalizations, COVID-19 hospitals, which presumably they're sick.
Look at the data
Sick
below. Children in states with low vaccination rates were nearly 4 times as likely to be hospitalized with COVID-19 compared to those living in states with higher vaccination levels, according to data released Friday by the CDC. However, virus-related emergency room visits and hospital admissions for young people ages 17 and younger increased over the summer across all 50 states, the data showed. Again, data, increase, blah, blah, blah. What about the numbers? Show me the numbers. They kind of undercut. So there's a slight increase, in some states that had a lower amount of vaccinations. Everything, all of this reporting is designed and filtered and twisted through the minds of the people writing them in order to encourage vaccination. Everything. You can read it all the time. The point of it all is to encourage the population, push vaccines. It's an agenda that clearly has an agenda, and in serving that agenda, they don't give objective data. There's not one in this article, and in the rest of the article, there's no figures either. There's no actual figures. They just waffle on in the same way. They don't give any numbers because, like, literally, when they say spiked in children, they could mean. It could be. It's not exactly this, but it could be that hospitalizations in children in the US across the entire country spiked from 1,000 to 1,100.
Right.
So that could be a 10%. That could be a 10% spike, and 1,100 children out of 74 million is how many? 0.001% or something like that. Do you know what I mean? So, but you don't give those figures because they make people think, well, geez, this isn't a big deal at all. Why are you even talking about this? Yeah, exactly. You wouldn't be talking about it if you were to give the context and the accurate data. So they don't talk about it and produce headlines like this so they can write articles and get clickbait and, whether intentional or not, scare the population into
bringing their children for COVID-19 vaccine.
To get vaccinated. There's just two. As an example, I picked 5 of these scaremongering headlines to try and get children vaccinated, but the last 2, Scotty, are harder to find, but it's because the media doesn't report on it. This one, for example, says that because one of the things they said that children with disabilities are particularly part of the reason they try and get push vaccination for children. And let's start with children with disabilities because they're most in danger.
And the quote immunocompromised.
Immunocompromised. But then there's been studies done that show that's not the case. That kids with disabilities in schools with other children, with other healthy children, they have no.
But this
greater
is
risk.
Confusing now because when this began a couple of months ago, the first thing they said was that we're going to encourage vaccination in children with disabilities. 2 months later, the headline suggests the opposite. COVID-19 transmission is rare for them.
Yeah. It's not that they won't vaccinate them.
This is
just conflicting data.
With their opening narrative explanation for why you ought to bring your children for COVID-19.
Yeah, well, at least your children who have some kind of health issue, which is, thankfully a very tiny percentage of the population. The vast majority of children are healthy. But even for the children that they make the case for, it's not necessarily true. It's not necessarily.
This is why our task is
it's
impossible.
enormous.
The opening act in the current drive with vaccines in children was, okay, just those with disabilities, severe medical issues, immunocompromised in some way or another. Okay, so that sounds plausible and reasonable. And then that opens the gates, so to speak. And then 2 months later, it's the reality, the data points to the opposite.
Yeah.
But it doesn't matter.
Too late.
By then,
Horses bolted.
healthy sports-playing teenagers have been vaccinated.
Yeah. And a bunch of them, a disproportionately large percentage of them are coming down with, for vaccines,
Heart
for
issues.
with myocarditis, heart inflammation. There's just one other one. I only really found two when I did a search of the media for articles that played down or announced, not played down, but announced objectively and truthfully that children are at a very, very small risk from this virus. Same as the flu, basically.
This takes me back to January last year, that headline.
Yeah. But that's also true
We
for
were
adults.
saying that. And
That's
then,
true for adults as well.
I know, but we said, look, we've done some basic numbers on this based on what the Chinese were reporting. And that is what we were reporting in January 2020.
Yeah, and we're back. We're still here.
Which spurred a massive, sustained barrage through February and into the lockdowns of, no, this is not like the flu.
You're
This
not
is
allowed
the
to say
Black
that.
Death. So who was factually correct? Who followed the science?
Yeah, exactly. It's not being represented in the media. The truth is not being represented by the media because the media, for some reason, is on board with the government. They're following the dictates of the government, right? A lot of the media, especially the major mainstream media, they have a very close relationship with government and always have done. They get information from government insiders for their scoops and their exclusive stories and stuff. So they've always been dependent on them, and they have that relationship going back a long time. So why would they change it now? Yeah. So
Yeah, the
there's I mean, yeah. Well, go to the Guardian article there, Scotty, just to follow up on this. That's just another piece of data that it's from July. About New Zealand, yeah. New Zealand children falling ill in high numbers. Now this is one that I came across and went, oh, the falling numbers in high numbers due to COVID, and I thought, no, wait, it's not falling ill in high numbers due to COVID. It's falling ill in high numbers due to COVID immunity debt, which has nothing to do with COVID at all, except in the sense that, it has to do with the measures that government put in place to deal with COVID, i.e. lockdowns. So basically, the article says New Zealand hospitals are experiencing the payoff of immunity debt created by COVID-19 lockdowns, with wards flooded by babies with a potentially deadly respiratory virus, not COVID. 46 children currently hospitalised, of course, is New Zealand, and again, 46 children out of 5 million. Again, it's like, and even when they're not talking about COVID, they're talking about, it's 46 out of, there's 5 million population, maybe break that down by a quarter. Usually it's about a quarter of children. So there's about 1.25 million children. So 49 of them are in hospital.
yeah.
Anyway, 46 children currently hospitalized for respiratory illnesses, including respiratory syncytial virus, or RSV.
We covered it at the time. It wasn't
Exactly.
just New Zealand, Japan, the US, UK. And the reporting was fairly accurate. I mean, that headline is kind of confounding factors, but at least they included immunity debt. Immunity debt was explained as a side effect. Oops, we didn't realize that doing lockdowns would break the normal seasonal transmission of common bugs.
Right.
Which would have to be paid back, so to speak.
Yeah, for
by
sure.
everyone when lockdowns were lifted.
Yeah, for sure. Compromising people's immunity because of lockdowns. And then
it's part and parcel of the dry tinder factor.
It's like being paid back, but for the benefit of lockdown. So we all enjoyed lockdown so much, now we have to pay for it. Is that the idea?
Well, no, that's just a scientific term.
But that's what happened.
Yeah, that's effectively what happened.
The way the guy says it, epidemiologist and public health professor Michael Baker used the metaphor of forest brush fires. If a year or two have passed without a fire, there is more fuel on the ground to feed the flames. When a fire finally comes, it burns much more fiercely. Basically, for viruses. What we're seeing now is we've accumulated a whole lot of susceptible children that have missed out on exposure. So now they're seeing it for the first time, and they're getting particularly ill for it because they haven't built up an immunity to it. Now, that's 46 out of... Do you know how many children in New Zealand died of COVID?
0.
I don't know. I couldn't find the actual numbers, but it's very likely that over the period of time, the past 18 months in New Zealand, there were significantly less children in ICU because of COVID than there are because of this resurgent RSV, respiratory illness.
RSV and other forms
So
of bronchitis.
so in New Zealand, in terms of children, the net benefit of lockdowns for children has been, well, less than zero. It has been no benefit. It's been detrimental for them. So a society that doesn't take care of its children, well, you know a lot about that.
But the horror of it is that this objective result of the detrimental effects of government/medical interventions in the previous 18 months have now produced a reality in some localities across the West anyway, where indeed they can objectively say, well, there is a spike in ICU child hospitalizations, which is a consequence of the lockdowns, which can be conflated with COVID-19, in part because the symptoms are so similar, but mainly because
You're testing them.
the first thing they do when they bring them in is test them for SARS-CoV-2, abbreviated to COVID-19, and say, oh, it's a COVID-19 case. It isn't a COVID-19. It's a severe bronchitis brought on by the immunity debt created by the interventions to chase the COVID-19. It's such
when children weren't in danger of it ever at all.
At this point, you have to either be, well, you're following along. All you're seeing is the headlines. You're feeling the fear.
And you're not paying attention, yeah.
Or you're paying attention.
Or you're paying attention.
Well,
And you're angry.
in the minority that are, they're angry and they're reacting.
I'm angry for good reason. I mean, especially people in New Zealand, in Australia, have more reason than anybody to be angry. Look at, go to that Queensland Premier Guardian article. It's another Guardian article. Queensland Premier vows to stand strong on border controls until all children are vaccinated. That means Queensland, the biggest state of which there are 5 or 6 in Australia, is saying that basically they're not going to get out of lockdown. The serious restrictions that are in place in New Zealand and in Australia are going to stay until all children are vaccinated. That's like from zero, like from birth.
And that's in a country that went from just 3 weeks ago, a total vaccination rate they claimed was just 17%.
Right. Yeah, and just look at the subheading there. Fewer than 1 in 1,000 infected children have entered ICU. So 1 in 1,000 infected children have entered ICU, but they need to get vaccinated anyway. I mean, it's how do you deal with that kind of doublespeak? Like where it's like we're saying basically the data says there's no risk to children, but we're going to vaccinate them anyway.
And no one gets out of lockdown until that happens.
Until it happens, we're going to punish you all until it happens. But the other thing about that subheading is that it really annoys me. Even in the 1 in 1,000 infected children, how many? 1 in 1,000 is an absolute number. I want to know the absolute number of infected children in Australia. You can bet your ass it's a tiny, tiny number. So 1 in 1,000, 1,000% of a tiny number already.
And then you want to know, give me the absolute number that are positive test cases for SARS-CoV-2, whichever variant, and then tell me which of them required hospitalization because of that or because of the immunity debt, RSV, and other type of bronchitis like respiratory illnesses that they are actually manifesting symptoms for. It gets smaller and smaller the closer you look.
Absolutely.
But the headlines and the government just go on and on. It's horrifying.
And speaking, we'll flip to the other side and look at the elderly now. Go to the other Guardian article there, Scotty. Care workers in England leaving jobs for Amazon and other better paid jobs. If you just read the headline, that's like, well, they're allowed to leave their jobs, but why are they leaving?
They're free.
Care workers are quitting to become Amazon warehouse pickers and for other better paid jobs in a growing staffing crisis, which operators now warn could leave 170,000 vacancies in care home staff by the end of the year. Policy reveal that slowing rates of the double COVID vaccination among care home staff, with 87,000 in England still not fully jabbed. From November, here's the problem, they will have to be fully vaccinated against the virus. 3/4 of care home operators are reporting an increase in staff quitting since April. The key reasons being a desire for less stress and for higher pay. and to avoid mandatory vaccination, which comes into effect on November 11th. Last night, the health worker union Unison called on ministers to immediately scrap the no jab, no job policy, warning that they are sleepwalking into disaster. And that's a good term, because that could be applied across the board to what's going on with this entire situation, is that authorities
Are sleepwalking into disaster.
well, some of them obviously don't care. Maybe they know, maybe they don't. But the people who are going along with it are sleepwalking into disaster. It's
Yeah.
not the government. The government are forcing a forced walk of the population
Off a
into,
short
into
plank.
disaster. Right.
Yeah.
So-
There's been some backlash on mid levels of management.
Right.
Nursing. I can't recall now. I don't have the headline to hand, but either at the state or at the private healthcare level, the employers of nurses in some U.S. states looked at the figures, looked at their mandates that were they either signed along to or they were forced from higher up still at the federal level to get all their employees to sign up to. Looked at the deadline, looked at the remainder still to be vaccinated, and realized they would be hit with 30% or more loss in staff in one fell swoop this month or the next month, whenever these deadlines come into effect. And so they backtracked on that and said, we are not now going to go along with that mandate. You will not be required. So at some mid-levels, they just do the simple math. I mean, they have a statistical mind. They are either big business managers or they are state officials.
Right.
And they're doing they're following the logical conclusion of where these mandates coming from higher up are going. And so they're lifting them. I think we'll see some degree of, is it common sense? Don't even think it's basic economic sense at government levels.
You think?
I think so. There's going to be there are some examples of undoing
Yeah.
or fighting, quote unquote, fighting back against the pressures that all healthcare workers must be vaccinated.
Yeah. Yeah.
But still, the overwhelming pressure is in the opposite direction.
Yeah, for me, when I read these articles, these headlines, the hysterical headlines, and the negative effects of all this kind of stuff, like you're just describing, it's I kind of get the impression of government and the media hysterically waving their arms, trying to convince the population that there's a real danger to their lives here, and that's what they've been doing that for the past 18 months. Freaking out, trying to freak the population out. And a lot of the population, though, have responded to that. Initially, they took it on board and said, okay. But then as time went on, they started looking around and they don't see the reality that the government is saying is there, that there's a deadly pandemic. People are, people are dying. It's kind of like the Black Death and stuff. People are look around and they don't see that as a reality. So they kind of like tend to ignore it. Even people who kind of went along with mask wearing and stuff. But then they start to, because the government doesn't get the response required from the population, doesn't hystericize them as much as they want, and they see the population are becoming less hystericized because they don't see a reality behind it. The government then wants to force that reality onto people by making them act as if there is a deadly pandemic, by locking them in their homes and stuff they're doing in Australia and stuff they have done over the past 18 months in other countries, And I suppose the idea might be that if you force people to act as if it's a deadly pandemic and people could, there could be millions dead in a moment or in a month. If you force people to act in that way, to take precautions as if that is reality, then they internalize that themselves and they start to believe it. I think that has been the effect of the measures, the restrictions on people's civil liberties, is to try and force people to believe against the evidence before their eyes.
And it has worked well. But
for most,
there is
even,
a
but
sizable minority everywhere
who just go, I'm only going to believe what's in front of my eyes, basically. I want proof. I want to see the evidence, and there is no evidence for what you're saying, at least to the extent that you're sounding the alarm. There is no evidence, so I'm not going along with it. I'm pushing back. And that's what we speculate. It's like 10% of the population, maybe, who knows, 10, depending on the country. But the rest, it's not even the rest are fully on board. There's an awful lot of people, I would say a big majority of people out there, who are just quietly trying to get on with their lives and not looking at any of it and waiting for it to go away so they can get back to normal life. If that happens, that's a good bet. If it doesn't happen, it's not a good bet because you've missed a big part of the process of it going somewhere less wholesome as that we might like, you know. That one, Scotty, one explanation for it all. People keep asking for explanations. Why would they do this? There's lots of explanations, possible explanations. The last one I just sent there, Scotty, is one explanation that everybody should take on board. Not that one. That one.
Loads of money.
Billions, and this is just booster market. Of course, the booster market is another jab for the entire population of well, as much of the globe as you can. But already, billions have been made from pushing the vaccines in the way they've been pushing them on the population. So, I mean, really, can anybody discount that? Can any reasonable person discount a greed factor in this? Can you say that greed and monetary profit is totally irrelevant to these people and it's only about public health? Who would say that? What reality, what world does someone who would say that live in?
Yeah.
I can't. I just can't.
I know it's
Can't get it.
it's
Sorry.
it should be obvious. Well, something that struck me is the number of I suppose generally extremely skeptical people, commentators, influencers, thinkers who, you know, anti-war, anti-corporate greed. Oh, they've been on that shtick for decades. It's their bread and butter. It's their market, you know, anger at government having been bought out by financial interests.
Right.
Big Pharma, they've got books written on Big Pharma's role in
influencing government.
buying government agencies.
Mm-hmm.
What do they call it? Regulatory capture is the fancy term for it.
Right.
For the scientific explanation of corporate greed overtaking what decisions governments make. Those same people were up there. They got their shots. They're telling their followers,
yeah.
what the hell is wrong with you?
This is a real pandemic.
This is a real pandemic. Get
So
the
they-
vaccine. I know it's Pfizer, but look, this is bigger than Pfizer. This is about the future of the human race. That kind of spiel.
That's the effect of the media and government propaganda over 18 months and the effect it has on people's minds, where makes them, or it has the capacity to make them forget everything they knew beforehand.
Yeah.
I mean, that's pretty powerful. That's crazy, you know. To remove all doubt from someone who was full of doubt beforehand. Fear, I suppose. Fear is the enemy in that respect.
On boosters, Israeli government this week is expanding. It's already well underway. They have something like 1.8 million of its 10 million citizens who have accepted a third booster shot
Awesome.
of Pfizer.
Sign me up.
Pfizer has exclusive market share in Israel. And now it's been rolled out booster shots for 12-year-olds and up this week.
Booster shots for everyone. Free boosters for everyone.
There's a carrot thrown in the mix. Byline from Haaretz. Israel also announces that those who have received their third shot will be exempt from quarantine upon return from international travel.
Yeah.
This was explicitly laid out by
I think it was
the
Sweden and
Prime
Portugal, two or three countries just this past week, banned people from Israel from traveling, from entering their country because of the rise in COVID cases.
COVID cases.
Or COVID infections or whatever. But the bottom line is the vast majority of them are vaccinated. So you have a country with a vast majority who's on first with vaccines and the vast majority of the people are vaccinated. Other countries are banning those citizens from coming to their country because they might spread the virus after full vaccination. That's why they're bringing in boosters, right? You need boosters to be able to go to other countries now.
Right. People jumped on that, but I point out that Sweden also introduced it for anyone traveling from the United States.
Right.
And several other Balkan countries. So they were careful, if this was even a consideration, they were careful that it would not exclusively be Israel and draw attention to the fact
And
that
be-
it's the most vaccinated population on the
Because you'd
earth.
be anti-Semitic if you were. If you did.
Something like that. Or Israel might fight back and do something. I don't know. So, okay, boosters in Israel, boosters across the board. I mean,
Because the vaccine isn't working anymore, right? That's that
well,
big.
they won't say
Well,
that, will
well, the
they?
big study was done to show that people
Actually, they will.
people who had a prior infection with COVID and had a natural immunity, that
Yeah.
immunity was stronger, significantly stronger than the immunity conferred by the
Yeah.
by the Pfizer vaccine.
It's just one of the dark things about this, where you cannot help but question their motives. Obviously, the greed motive in the example there of Pfizer. In January of this year, before the primary rollouts had any time to show any kind of data in terms of efficacy or whatnot in Israel or elsewhere, the United States, the Pfizer was interviewed by Bloomberg, and their guy, the CEO, Bourla, Anthony Bourla or something,
Yeah,
explains
a Greek dude.
ahead of the results that have come in the last 8 months, ahead of that, he explains in no uncertain terms that what he foresees is annual
Yeah,
COVID-19 shots, quote, just like flu shots.
yeah.
That was the market position, clearly, that he sought at the outset.
Mm-hmm.
Lo and behold, the data actually supports that. Oops, it looks like. And Israel has done similar bans of travelers from other countries, with the rationale being you cannot come in because you're fully vaccinated, yes, according to the goalposts of several months prior in late spring, early summer. But now the data shows that the efficacy wanes after 5-6 months.
Right.
You must prove a recent
Infection.
infection, or preferably, of course, a recent shot of
Right.
COVID-19
A more recent,
vaccine.
yeah, like in less than 3 or 4 months, because it
So
wanes after 5 or 6.
The policy and the results from the vaccines are synchronized, and they seem to have been synchronized from the outset. They knew the efficacy would not be
Yeah.
but part of the lie at the beginning was, oh, well, you must get this because natural immunity will never.
Crap, yeah.
Since then, data shows natural immunity is far superior and long-lasting.
Yeah.
It nearly always is
Yeah.
vis-a-vis artificial vaccine immunization. And now, well, that would normally we would imagine that the news that the vaccines are not working would be just a curtain raiser.
Yeah.
It'd just be the end. It would
Disastrous.
blow a hole in this thing, and
Yeah.
it would be governments would fall, kind of thing.
Yeah.
No. From
No.
the outset, they knew that. They were perfectly comfortable with expecting to flip that narrative into
boosters.
It's got to be every 6 months.
Right.
An mRNA experimental vaccine.
And why would
God
why,
knows what it's doing.
And why would they do that every 6 months?
Well, the first one obviously is
Money,
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 money.
money.
Yeah. Well, obviously for Pfizer, yeah, and for other vaccine companies, it's like a boon. It's like Christmas every day. Just on Australia, I mentioned Australia and how they win the asshole prize across the world for being totalitarian assholes. The most totalitarian assholes of them all, really. There's, we were talking earlier on about Australia. They announced it a few weeks ago that they're opening a quarantine facility that will have 500 beds by the end of this year, and will have up to 3,000 beds by the middle of next year. So next summer, Australia's going to have a 3,000 bed quarantine facility outside Sydney. Obviously, the Australian government isn't planning on this ending anytime soon, if they're doing that. But just to give you an idea, there was a video posted by a guy inside one of these. Well, it was a quarantine hotel, but it's policed by the police. So the police keep you in your room for 14 days in a hotel. It's the vid I sent, Scotty. Have a little. We'll just let you watch a little bit of it, just to give an idea of what it's like inside one of the hotels. Actually, well, yeah, watch.
I never fucking thought that I've been here. I'm not fucking staying here any fucking longer. Why? There's a fucking door. There's no fucking door.
So it sounds like they want this guy to stay here longer, which is concerning for me because he's stayed here for 14 days he doesn't even have a crossword.
Yeah, except it's not fucking embarrassed. If you weren't fucking listening, it's fucking off.
I feel for these guys. This is shit. This is hotel quarantine.
12 fucking clock, midnight. What the fuck is the point of that? I live 3 hours away.
It lives 3 hours away.
So he's supposed to be at 12 o'clock midnight.
For how fucking long? I'm not fucking staying here tonight. In my fucking room. Move me to a different fucking place.
Do you know what? I reckon he's been here 2 weeks. This is out of control. This is police quarantine. This is shit. This is totally shit. Poor guy. Fucking hell. People go crazy in hotel quarantine. You obviously know there's a guy going off his head. Listen, why is he going off his head? Is it because he's supposed to be let out and you guys haven't let him out? Can someone call me? Can a doctor call me? Because I find this really disturbing.
No doubt.
Hi, there's a guy going off his head. You obviously know that. There's a guy going off his head upstairs. He's punching walls. Yeah, can I ask why is he doing that? Is he supposed to be released from police quarantine? Yeah, but... Jeez, okay, bye. Fuck. Fuck. I think he's my next door neighbour. I don't think he's having a good day. But I heard him say, I'll say it again, that he was supposed to be released. And this is what I get worried about. I'm supposed to be released at 11:59 on Tuesday night. And he's still here. And I reckon I'm scared that after spending 14 days here, 338 hours in one room with no air, and then they tell you can't leave, I reckon I would go off as well. People can't understand the insanity of hotel police quarantine when you can't get any fucking air in here at all. It's madness. It's absolute madness. And you have, what do you have, 7 tests in here? Like he's negative COVID.
7 times. All right, I think that's the end.
I feel for this guy. Surrounded by police.
Yeah.
Wow.
So the sad thing about for me is that anybody would put themselves in a position where they ended
accept
up,
that.
where they ended up in a in a hotel room like that, or in one of those quarantine facilities. You know, why would you ever do that? I mean, it's complete cluelessness to it's a lack of like self-preservation in a certain sense, or a lack of
Yeah.
skepticism, or at least an iota of suspicion about the intentions of government.
Yeah.
That's what happens when you don't have that healthy skepticism about the intentions of government. You think it's all for your benefit. This is for public health. We're doing it to protect you. We love you. You know, kissy kissy. Just go to the hotel. Everything will be fine. You'll be a hero. You're protecting the population and stuff. And then that's the reality of it. And you find out the hard way. You know that you shouldn't be so naive. But maybe people need to learn the hard way. Well, they have to. People are in this environment. In a world where you have governments with less than wholesome intent towards the population. If you're naive and you think if you don't won't allow that to be part of your reality, then you are going to learn the hard way. Probably you better be prepared to learn the hard way.
That's definitely a big factor, and the people should obviously try to avoid putting themselves in such situations. But this is Australia. Cast your mind over other recent reports where they had helicopters scanned for and find boys hanging out after dark in places they shouldn't be,
Yeah.
police handcuffing them, arresting them, and taking them home. Sports stars, whether stars or just sportsmen, period, found to have tested positive but not stayed home, been tested and tracked. I don't think they submitted to, the app or anything like that. I think they're using, the app is a bit of a mind trick, because the reality is if the state wants to, in conjunction with intelligence services and big tech like Apple, smartphones and so on, they know where you are. They know what your situation ought to be if you are or not following the rules. And they've been tracking people down. There's a guy, for example, who was dragged out of a hotel room where he was not on quarantine, hotel quarantine. He was a fugitive. That's the Australian media's word. He was a COVID-19 fugitive. He had tested positive.
A COVID-19 fugitive, not
Yes.
a normal fugitive. Okay.
And they eventually found him, had media waiting for the show, which was police and doctors accompanying them in full sort of medical gear, protective equipment, blue goggles, blue gloves and so on. We never saw his face, but he was named and shamed publicly. And they have him coming down and into the courtyard of the hotel in handcuffs, also covered head to toe in similar medical garb, handcuff, gloves on him. And the journalist sticks a microphone in his face after saying something like, asking him why he did it. You shouldn't have been doing that. You broke the law, kind of thing. The journalist was just total yellow journalism. And he says something like, I didn't, I don't submit to,
Yeah.
I feel fine. I'm perfectly healthy. I was, in fact, he claimed I was in fact isolating at home or something like that. I mean, what I'm trying to say is that they are proactively seeking offences.
Yeah.
Left, right and centre.
For sure. Yeah.
So there's a bit more than just try to avoid, getting caught up because, you're naive. There seems to be an extra element of going after perceived, if not actual, dissenters as an example to set it.
Yeah. Well,
examples
if
to
you're
others.
smart enough, you can avoid that as well. You know what I mean?
Right.
If you're aware of the ways and means, you know what I mean, and to keep yourself safe if you perceive yourself to be on the wrong side of the law in that respect, whatever new law there is, the COVID laws, basically, if you perceive yourself to be on the wrong side of it, then you better expect that kind of stuff. You know what I mean? That's the kind of reality we live in, and people have had ample example over this past year, if they're watching carefully, of what this is really all about, what the point of it all is. 2 by 2 hands of blue.
2 by 2 hands of blue.
That's a secret code. It'll be a prize for anybody who knows what that reference is. I'm sure plenty of people will, actually.
Okay.
Let's just on the kids thing. Go to the CNN there, Scotty. The headline is more kids are catching COVID-19, and it's got CIA boy Anderson Cooper and I don't know what do you call him? What do you call him out of Harry Potter? Little elf. Nobody knows. Whatever the name of the elf is in Harry Potter, that's him on the right. He's also masquerading as the director of the National Institute of Health and the all-knowing COVID man. So the title is "More Kids Are Catching COVID-19." Very good, thanks very much. It doesn't mean anything to anybody.
look at the banner above it. Coronavirus: fact versus fiction.
Fact versus fiction, yeah. But anyway, this is just Fauci correcting a prediction. It's interesting, like in terms of them kind of trying to backtrack and cover up, mistakes, or all for the purpose of making sure that the whole thing continues on for as long as possible. Just let's play a bit, and I'll tell you to stop. Maybe, or maybe I'll just comment over it. Go ahead.
So, Dr. Fauci, I want to get to the FDA approval in a moment. First, I do want to ask you something about that you said to NPR today. You said if the majority of Americans get vaccinated, quote, we could start to really get some good control over this as we get back into the fall of 2022, a year from now. Is that the best case scenario? And what does control look like?
No, Anderson, I have to apologize. When I listened to the tape, I meant to say the spring of 2022.
Did
So
I
I
say
did misspeak.
Was there?
And in the conversation,
Did I say fall? Like as in soon? No, I didn't mean soon. That would we control over it? That we'd have some control? Because people might think that control means that it might be going to end or that we go back to normal. No. And definitely not now. I meant like next year, like at least 6 months away, possibly. So okay, he's clarified that. He didn't mean it's not going to be over soon. Just in case anybody thought that.
Well, Cooper said to him, I heard you say fall of 2022. And Fauci was, no, I'm bringing it forward. So in a sense, he's off.
Yeah,
he's,
exactly, yeah.
It's not as bad as...
Yeah, he misspoke. It was a wish list, basically. I meant 2022, but 2022 anyway. Definitely not anytime soon. Carry on. Let's see
conversation with Mary Louise Kelly, she was saying, when do I think we're going to start to get some control? I said, if we can get through this winter and get really the majority, overwhelming majority of the 90 million people who have not been vaccinated, I hope we could start to get some good control in the spring of 2022. Okay. I didn't mean the fall. I misspoke. My bad.
Pause there.
Okay. What?
So he hopes that he misspoke. He hopes that we can get some good control, and it's all contingent of on the 90 million people who haven't been vaccinated getting vaccinated. So vaccination is the answer to everything. Right? If every single man, woman, child, and dog, and parakeet, and cat,
zoo animals,
and
for
zoo animals are vaccinated, then we might get. Notice the words. We might get some control over it, good control over it at that point. What that means exactly? Well, good control, could mean anything really, you know what I mean, in terms of how it applies to people's lives or how it affects people's lives, don't know. But it's all contingent on vaccination. And this is despite the fact that the vaccines, like we've just been saying, in countries like Israel and other countries, data coming out showing that they don't really work for very long. So this would tie into continued vaccinations going forward for forever, and always the opportunity.
Never mind the data that suggests that they are worsening and extending the pandemic.
It could well be actually extending the pandemic by creating vaccine escape. Let's just listen to Little Elf.
What does control? What does that mean, or what does that look like to you?
What does it mean? You like control, Fauci. What does it mean?
Well, to me, that means that you have either the overwhelming majority of the population vaccinated, those who have been infected will have and have cleared the virus, will have a degree of protection, and we are recommending that those people also get vaccinated, because the degree of protection that you could induce in someone who's been infected, who has then recovered, and then vaccinated is an enormous increase in the degree of protection. If we could do that with the people who've been infected, get them
would be very
revaccinated.
happy.
The people who are unvaccinated now, that 90 million people, get them vaccinated. I think we can get a degree of overall blanket protection of the community that as we get into the early part of 2022, getting through the winter, which could be complicated by influenza, by respiratory syncytial virus, that as we get into the spring, we could start getting back to a degree of normality, namely reassuming the things that we were hoping we could do. Restaurants, theaters, that kind of thing.
Oh, a degree of normality. You get to eat in a restaurant if everybody gets vaccinated. You notice he said he's backtracking, but you have to know the context.
Much better.
On that kind of stuff. You have to understand the context where he said, him and others all said last year that natural immunity, like you were saying earlier on, is crap. Natural immunity, no good. Now he's saying natural immunity, it gives you a degree of protection. Again, he's mincing his words there. Natural immunity, the studies show, gives better protection than a Pfizer vaccine. But he's trying to combine the two now, saying, the degree of protection that natural immunity gives you is massively increased. Enormously increased when you get a vaccine on top. It's amazing. And if we just get those 90 million people, and he probably dreams about 90 million people, but he sees them like in terms of dollar signs, right? But he probably does the math in his head, 90 million times how many dollars per vaccine, blah, blah, and he just, wets his pants in the bed, So, that's my interpretation of Fauci. He's a evil little elf, and he should be arrested.
He should be, for misleading the public.
For being a little. Anyway,
Thick as a fish. I think we should
yeah.
just sync up something in terms of the opening topic on this overall topic of our show. Namely, are they coming for the kids?
Yeah.
Because that's a serious concern in that they seem to be already have opened the way, as we discussed, for this to become mandated. Now, the problem with this, well, among the problems with this are the fact that everyone understands the parents have a say in the health and well-being and the raising of their children, right?
Yeah.
That's well understood across the board. Yes, there are certain vaccines that are mandated or almost completely uptaken by young infants. But there's a major component of a social contract involved in that. Mothers are not dragged, kicking and screaming with their newborn infants when they get vaccinated for measles, rubella, tuberculosis, etc. They understand that that's safe, and normal thing to do. Or here, this is something else entirely. This is part of preparing the ground. Can you throw up that article from Politico? Apparently, parental rights ain't what you think it is anymore. The dangerous legal illusion of quote-unquote parental rights.
Awesome.
This is a legal argument. I'm seeing it all over the place, but this is just one version of it. Scroll down there. Mask mandates have become politically charged subject. At least 6 states in the U.S. Southwest banned such mandates. And then, of course, they cite the it's a false representation of what's going on out there by citing the raging Delta variant representing a threat to children, although they say increasingly likely to become infected. At least they don't out and out claim that is the case. But it goes on to explain that, scroll down a bit more.
Parents opposed to mask mandates said a variety of arguments, be they philosophical or political, erroneous or conspiratorial, but perhaps the most common, misguided and dangerous reason is that mask mandates for school children violate ill-defined but allegedly comprehensive and paramount parental... Wow. So parental rights are a misguided and dangerous reason, or parental rights are misguided and dangerous. So, who's writing this?
This is a lawyer writing it for Politico.
Nazi.com?
He then brings up legal precedent. As the Supreme Court said in this case, Prince versus Massachusetts, parents are not free to, quote, make martyrs of their children by putting them in harm's way. Governments, interesting slip up, governments can and do limit parents' discretion with the goal of protecting the health, safety and welfare of children.
Okay.
And then an absolutely farcical analogy by comparison, which we've seen all over the place recently. One example is the child car seat requirements, which exist in all 50 states. So you can see where they're going with this. It is indeed the case that social welfare employees in any given country can intervene. They do intervene all the time.
Parents are abusing their children,
Yeah.
But in this case,
They're going
not vaccinating your children is going to be abuse.
That's what they're implying.
That's what
they're implying here, that if you are not going to accept that your children be vaccinated, you'll be found to be, your parental rights won't exist.
Yeah.
Because you are putting them in harm's way. They're going to try and make it analogous, I presume, to something like a Jehovah's Witness declining emergency medical intervention when their child is seriously wounded or sick for religious reasons.
Right.
Which would objectively medically put them in harm's way.
Right.
And there have been plenty of legal precedents there. And they're going to use such examples here. And again, it comes back to the underpinning of the whole thing, which is that there is a mortal and severe threat
2 children.
2 children out there.
When there's not.
Then there isn't.
When it's 1 in a million. Literally 1 in a million
To
children.
drive the point home, do you want to listen to it? The
Who?
Canadian education minister was accosted
Yeah.
on the streets
I always want to listen to Canadians.
this week. Let me just
I
send
don't
this
get
to
enough
Scotty.
opportunity to listen to them.
It's not very clear, but I think we can hear him respond to an irate parent who's shouting at him saying, "What about parental rights?" And we'll hear his response. Basically, he's going to say, "You don't have such." And we're continuing. We're going to continue vaccinating children until 90% have been vaccinated.
How can you say it's all right to vaccinate our children? It's our children, not yours. Doesn't matter.
You don't even have children.
They are not the state's children.
That is absolutely against everything. You are absolutely. He doesn't even have children of his own.
I'd bother him.
You are absolutely disgracing parental rights here. You are a human rights violator. Thanks, Nick. Yeah, I'm a loon. Great comeback. Why don't you come with some philosophy? That's all he does is name call. Real? Instead of calling me names, why don't you? We can call names. You're a piece of shit. That's what we're standing for. Like a piece of shit. Freedom is what we stand for. You just said the state owns your children. Hey, excuse me. You stand back if you like. I'm not moving.
Yeah.
I'm not moving. You got a mask. You're
Kick his
protected.
ass.
You're good. You're protected here. You're protected, right? You're good.
He's even laughing.
What I'm looking forward to is watching your political objective be utterly annihilated in the election coming up in a few weeks, and the people who are standing up for a genuine community.
Yeah, because you got 1.6 billion of our dollars going to CBC. You just said the state owns your children.
We have a
We'll go. We're out of here.
We have a collective responsibility. Earlier on, he said they're the provinces. He said they're not your children. He said they're the provinces' children.
I couldn't make it up because it was bloody mass, but you heard that. Okay. Fascinating. So I'm not sure if he's possibly he's a minister for education for the province and not nationwide.
for
But
Ontario, yeah, maybe.
did you hear what his thing at the end?
Yeah.
His response has come back. We're looking forward to utterly annihilating you and people like you in the upcoming elections. Trudeau's called snap general election for Canada.
Yeah.
Official polls show him actually he's gonna lose.
Yeah.
The hubris, I think, is that these guys did that because they want to get a mandate for what they're rolling out in Canada.
Uh-huh.
And this guy, he seems very confident that the overwhelming majority of people in Canada will support such things as mandatory vaccines for
children,
for children.
and that you don't have any parental rights, and that if you refuse, then your kids will be taken away from you and vaccinated without you.
Is that hubris or is he right? Is he smirking behind that mask because he knows he still has majority of the population will back them?
Those people are trying to see how far they can push it, basically. They're obsessed. They're high on the power trip that they're on, getting to control and dictate the minutiae of the lives of millions of people. They're loving it, and they want to push it as far as they can, and they want to take as much power and control back to themselves, take it from the people to themselves. It's not rocket science. Like, this has been a power trip for many politicians and many people in different, not just politicians, but down the line, doctors and different people who get to make the rules for other people and enforce the rules for other people, for millions of other people. No more so than among the political class who are coming up with these rules and passing them down. And he
made no effort to reassure that man.
It's a sickness. It's a sickness, and they can't stop.
He made no effort to say anything comforting or even to use doublespeak on that man. He was gloating back at him.
Yeah,
you don't have parental rights, and I can't wait for the elections to show that you will be the minority, and we will have basically between the lines we will have been given a political mandate to trample on you people.
Yeah. Pretty scary stuff going on. One other thing, Ivermectin, Joe Rogan. Most people don't know who Joe Rogan is, right? Not most people watching this, but most people in the world don't know who Joe Rogan is. You have to remember that, even though you might watch him a lot. Most people don't know who he is. But he more people got to know who he was recently because He's taken a stance before on vaccines, but recently he basically came out and said that he had the COVID, and it was pretty bad. He had a fever and he was feeling crap, basically, kind of like describing a flu. And but he said he took a bunch of things, and within 3 days he was feeling great again. And he made this video 3 days later. He was feeling fine. He looked fine. And he said he'd taken ivermectin. So that apparently got around enough, and it was a topic that he strayed into. That meant that the media then had to basically give him some coverage and come out en masse in general against ivermectin as a treatment for COVID. And the way the media has gone about it is that they have decided, and people all over Twitter took up the mantle of calling it a horse medicine, which it is used it's an antiparasitic, and it's used in horses, but it has been approved by the FDA it was approved by the FDA 40 years ago, and has been used widely among the human population. Just a smaller dose, obviously. You take a smaller dose than a horse, but it's the same drug. But the media has been all over it, basically calling it the horse medicine.
Wasn't it instrumental in trials and studies that led to the 2015 Nobel Prize?
That's right, yeah. Yeah, for sure, yeah. Yep. And
But they just chant in unison, horse dewormer.
Yeah, for sure. BBC, Scotty, ivermectin, Oklahoma doctor warns against using drug for COVID treatment. First line, a US doctor is urging people to stop taking the horse deworming drug, ivermectin. Now, this is the BBC. How obtuse or idiotic or stupid or whatever do you have to be if you're a BBC journalist writing this article to start the article against ivermectin by claiming it's, in isolation, claiming it's a horse deworming drug, and not mentioning that it's actually also used, probably more frequently, for humans as an antiparasitic in humans.
Yeah. It's insidious in the cleverness of the positioning. That's the first line. Look at the third line.
Small doses of ivermectin are approved for use on humans. Well, yeah, but you can say that about any drug, I mean,
and this is the giveaway, but not for COVID.
Yeah,
that's the giveaway because
that hasn't been approved for COVID. But
because if it were,
right, because they won't approve it,
the vaccines would never have gotten emergency use approval.
Yeah,
because there are proven studies showing its effectiveness.
Yeah,
ivermectin and hydroxychloroquine. That's why, putting on the conspiracy theory hat here, that's why they were knocked off the shelves at the outset of this in February, March 2020. Someone knew we need to remove these several things here, because without it, we won't get the legal justification of emergency use authorization.
I have a cup here of horse refreshment that I'm drinking.
What, liquid ivermectin?
No, it's water.
Right.
It's also approved for use in humans as a refreshing drink to hydrate. It's also used in horses, but smaller doses for humans than you would give to a horse.
Why on earth would you drink something the horses drink?
Don't know. Seems all right to me. Like, it's good for hydration and staying alive and stuff. I understand it could be dangerous if taken in very, very high quantities, like as much as you give to like an elephant or something. But I usually don't do that. I try to stay away from drinking, 50 gallons of it in one go. Anyway, that's just wanted to let people know that it has been approved. It's been used for quite a long time. Killing zombies is also approved by the FDA. Well, just on that article, but the reason I brought up that article basically is, if you just go back to it there, Scotty, handful of people overdosing on the drug were putting further strain on hospital staff already stretched by a surge in COVID cases. So this is a doctor called Dr. Makalea. The emergency rooms are so backed up that gunshot victims were having hard times getting to facilities where they can get definitive care and be treated. He as he clutched his pearls, said, ivermectin, mainly blah, blah, whatever. Deworming is mainly a veterinary deworming. What do you mean by mainly? Like, Jesus Christ. Anyway, Is that yeah? Because horses are bigger than people, and overall, in the usage of ivermectin, you give more ivermectin to horses because they're like 5 times the size of a person. What kind of bullshit? Is this meant to be journalism? Anyway, the point about it
Technically,
is
then he can say I was right.
Anyway,
It's
this-
mainly by quantity.
yeah, but that's not how you do proper journalism. You're a yellow scumbag, yellow journalist scumbag if you do that. Dr. McAleya. So Dr. McAleya, he's some dude in Oklahoma, doctor, and he's claiming that he's kind of like justifying his presence, I suppose, on the BBC, and the BBC went and sought him out because the only person they could get to say something negative about ivermectin. He works works or associated in some way with a hospital that he's saying, that the ER room is overrun with people taking too much ivermectin or something, blah, blah, blah. But the hospital that he actually was referring to, that he claims he worked in, if you just bring up admin, Scotty, the picture admin, this is the hospital, the Northeastern Health System that he was talking about, and they released this on their Twitter account. Although Dr. Jason McAleya is not an employee of NHS Sequoia, he is affiliated with a medical staffing group that provides coverage for emergency rooms. He's affiliated with a medical staffing group, some independent medical staffing group that temporarily, now and again, does coverage in their emergency room. But the important point is that he has not worked at the location that he was talking about and claiming that he was giving eyewitness reports about it being overrun. He hasn't worked there for over 2 months. He hasn't treated any patients due to complications related to taking ivermectin. So
This includes not treating any patients for ivermectin overdose. So
Right.
he has no clue about the specific claim the
he's-
BBC
no,
brought
he's
up.
basically making it up. And the point, what's the point? The point is to diminish any potential treatment that isn't patented, doesn't have that big pharma companies don't have a patent on any treatment for COVID that they can't make vast amounts of money for, which is ivermectin. They have to dismiss, diminish, trash any drug in that category that they can't make money on, and as a result, obviously push vaccines. This is another process of them pushing vaccines, and the BBC being directly implicated in pushing false information, false news, not only in their own journalism, but in the people that they get to stand in and make commentary as experts. They don't do the proper research and find out that the guy's a fraud, basically. He doesn't know what he's talking about. So that's the level of bullshit they're dealing with in the media, and people are subjected. And people wonder why. Should we wonder why people have no fucking clue what's going on and are making all sorts of wrong decisions across the board because they're getting information from a bunch of liars who tend to lie an awful lot. Because they've got an agenda and they're stupid or whatever. So, whatever, I don't know. On ivermectin, one more thing. Just to back that up. PubMed, Scotty, that NCIB, a 5-day course. A 5-day course of ivermectin for the treatment of COVID-19 may reduce the duration of illness. There you go. That's just one study. You can go and look up. There have been multiple studies done on ivermectin. The ones ongoing right now, most of them showing, suggest that it shows promise to at least reduce the duration of illness, i.e. it is an effective treatment. It's very cheap. It's widely available, but it's being essentially banned, and people are being scared into not taking it and not even asking for it when it could actually help them. Why? Like you just said, Neil. It's because they want people to take a vaccine instead. They don't want people getting better. They don't want to look into anything that would help people to get better from COVID.
That's
and get over
why
it quickly.
Joe Rogan's anecdote required, quote, the special treatment.
Yeah.
Because he is very, he's well known to any halfway internet savvy American audience.
Mm-hmm.
So when he comes on, anecdotally, it wasn't even on his show. It was just him, selfie 2-minute clip.
Right.
Saying, so yeah, I was sick. We're going to have to postpone a show. What happened was, came down with COVID. Day 1, shitty. Day 2, my doctors said ivermectin.
Yeah.
He took it. Day 3, feel great, back to work.
Yeah.
And that is why it was dangerous, because he was anecdotally
validated.
punching a big hole in, at least as far as washing the brains of Americans is concerned.
Mm-hmm.
So that's the flip side. The flip side is the propaganda is not working on
A lot of
The,
people.
the third that Fauci is having wet dreams about getting.
Yeah.
You see?
Yeah.
That's what's driving them into further and further desperation and further, increasingly extreme measures. Something to look forward to. The Socialist Party in France has introduced a bill in the French Parliament, which if it becomes law in October, so it's still in the works, it's going to mandate that everyone be vaccinated. They haven't stipulated an age requirement, but that is presumably going to include children. Asked to justify this shift in policy, a spokesperson said, well, it's simple, really. Equality.
Equality under the law, under the COVID law.
Because you're not vaccinated, we're not equal. You're going to get this. We all pay the price. It's gas because you can see it driving them. Anecdotally, you can see how angry they get. Many people who have been vaccinated, so they're fully bought in to this thing,
Yeah.
right?
Yeah.
There's a lot of anger on their side too when there's people resisting and saying, no, I won't. Because they have buyers, they fear the back of their mind, buyer's remorse.
Yeah. Or they want other people
So
to validate.
everyone better get this.
Yeah. To
So that we have an equal chance of succumbing to Russian roulette here.
Yeah,
And the 5% this thing takes, if it's ever that high,
yeah.
means that you're statistically will spread
Right.
the statistical numbers who will succumb
But also people.
to
Yeah.
vaccine adverse effects.
If
So
they
the
do.
more who get it, the more protected I am
Yeah.
in this game of Russian roulette.
If they have that much, some of them maybe, but I think a lot of them are pissed off at people who don't like unvaccinated people resisting the vaccination because it brings into question their decision to get vaccinated. You know what I mean? I mean, if I get vaccinated, I think it's awesome, and I buy into the narrative about how it's awesome, and everybody should get vaccinated because everybody could die from COVID at any moment, and you need to get vaccinated to save your life. If I buy into that, and then I see people who are saying, "No, I'm not getting vaccinated because I don't need it," I start to go, "Well." I start to have to question my whole narrative about it, the narrative that I bought into, and I'd rather everybody else in society backed up my reality, basically, supported my reality rather than a bunch of them out there kind of questioning my reality, questioning my decision, In France, talking about France, yeah, RT Scotty has a good long list of Twitter protests. Thousands. This was 2 days ago. Again, I don't know if we were saying it on the show, whatever. We've been covering the protests in France and in other places over the summer. During August in France, there were quite large numbers of people. There were 250 protests on Saturdays around the entire country. Numbers, depended, 250, 300, 400,000, whatever. But that was during the summer holidays when most people are away. We kind of had been predicting that in September there would be a lot more, and it seems to be the case. That once people are back from holidays and then on Saturdays there's a lot more a show of force basically among the population.
Big time.
This was in Paris. I mean, Paris easily,
Police claimed just 18,000 at that one in Paris.
it's kind of crazy. There's multiple protests in Paris on Saturdays, and there are people saying that there easily could have been 1 million people in Paris yesterday against these measures. Now, remember, they're not against vaccination per se. They're against the restriction of people's civil liberties when they make the personal choice not to get vaccinated because they've decided that they don't need to, and that there's no health repercussions for themselves or for anybody else because they don't get vaccinated. That's what they're protesting about being unfairly treated
and
for making that choice.
A chant that's increasingly popular is "Touche pas nos enfants," don't touch our kids.
Don't touch our kids. That's really galvanizing a lot of people, as you can imagine.
Vaccinated and unvaccinated.
Yeah, because adults can make the decision to get vaccinated or not vaccinated, but if children, it's you're crossing a red line really when you try and. For a lot of people, you're crossing a red line when you try and force things on their children and take, as we've seen with the Canadian guy, the government basically deciding that it has more control over your children than you do. Paris, yeah, just scroll down a little bit more. The next one. There's a bunch of them you can see. That one, another in Paris. Those are all 4 from Paris. Gay in Paris. There are multiple ones in the city. Is that one Paris as well? Are they all Paris? All Paris. Yeah. Well, there were plenty. There's one in. There's ones all over big cities all over France. Albertville, blah, blah, blah. There's too many. Literally, if you look at the map, it's like on any given Saturday, like I said, 250 different towns and cities.
Possibly higher, but
Yeah.
the numbers are stretching. Oh, look
See,
at Valence. Go
go
back to
back to that
Valence. So Valence has a population of
64,000 people.
64,000 people. Something in the order of a tenth of the population of that city was out.
Yeah.
A tenth? Yeah.
A tenth.
One in
A tenth is a lot. If you get the imagine a tenth.
You multiply
of
that across hundreds of cities.
Well, I mean, it's instead of like Paris, it's 1 million people. You know, a tenth of the population. In a city like New York, it's about whatever New York is, like it's 600,000, 700,000 people. You know, in big cities, it's a lot of people, and you can always assume, as a rule of thumb, you can assume that the number of people are actually willing to get out on the streets and spend their time marching. You can multiply it by a factor of 2 or 3 or 4.
Who feel as
people
strongly.
who feel the same way, support them, but for whatever reason aren't actually out in the streets. So yeah, that's why protests, while they might seem small, relatively small in the country, that's why they kind of tend to worry the government and why they can affect change in government policy, because the government uses that rule of thumb that there's a lot more people who support these people than we're actually out in the streets. You know,
While clearly lying about the numbers
Right.
that are out there. Paris, they said 18,000 total. One of the demonstrations was a guy, he didn't use a drone, but he used, like a camera and a large selfie stick. He counter-walked from the beginning of the procession to the end of it.
Mm-hmm.
Then did a time-lapse speed up where you see the whole thing in 2 minutes. It's about 10 across. 10, let's, for argument's sake, 10 people across at any point in time. Sometimes it's more densely packed. And it's 5 kilometers long. And
That's
it's
a lot
one
of
of the 4 major demos in Paris.
Yeah, but that's
the
why
police said total in Paris 18,000.
that's ridiculous. I mean, there's so much
That's
bullshit.
downplaying on 2 orders of magnitude. I'd say it's more like 1 million plus in Paris.
Yeah.
300 cities across the country, big and small.
There's so much disinformation out there, and the only information that you're meant to take seriously is anything that comes from official sources. Because a lot of people believe that because they won't allow for the fact, like I was saying at the beginning of the show, they won't allow for the fact that authorities would actually have their own hidden agenda and would be, misrepresenting things or outright lying to the population. Most people, they don't want to go there. They go there on certain things, but not on
small
this.
things.
Yeah,
They know that they'll be the same people who tell you, well, politicians are corrupt.
yeah.
They're on the take all the time. Jesus. They know that, but it's the big lie. And the problem is the bigger the lie,
The less likely.
as the Nazis famously were very self-aware
Googled,
of, the more reticent they are to broach the cognitive dissonance required,
Right.
because that
It's
requires
harder.
a lot of brain pain
Yeah.
to go from here all the way over there.
That they would do that.
Yeah.
We can accept that they would do certain things. They would fill their pockets. They would do little things, take some money from here or whatever, or get cash for favors or whatever. And you can let them away with that. But the big things, no, they would never be so monstrous, so criminal. The criminality doesn't extend that far, because if it does, I'm screwed. So I can't believe that. I actively have to refuse, in my own mind or subconsciously, I actively have to disbelieve the idea that the government would do something along the lines of a big lie, because, well, what kind of world do I live in then? How can I live in such a world? How can I navigate it? It's impossible. I mean, it puts people in an impossible position where the very fact that the government is able to
they
do
would just
something
do
like
it.
that.
Life is very easy to navigate without them.
No, well, it's easy to navigate without them, but the problem is that the implication in a big lie is that for the average person is that
it makes life harder.
Well, it's obviously makes it's that the government, the implication in a big lie is you're implying something that involves
threat.
a lot of power and a lot of influence.
A threat, basically.
Well, a threat based on the level of power that the big lie implicates or implies, that the government has and what it's willing to do. You know what I mean? Ordinary people can deal with little petty tyrants or little nasty little politicians or whatever, because they can always be voted out. But if you're positing something that involves the entire system, or that someone or some group that controls the entire system, well then for the average person there's nothing they can do about that. You're implying that there's some monstrous and awesome level of power and control over the population that by definition they can't do anything about. They can do something about the petty tyrant politician. They can vote him out of power. But what you're proposing, or what we might propose in terms of this COVID business, that's something that just by definition, by its very nature, is something that is so. What's that phrase about from the guy that talked about who was it said that about in the halls of power? There's a power on the. There's who's that guy? I wish I had that quote. That men fear to speak its name or only whisper its name and stuff like that. Who was that? Was that Eisenhower?
High cabal. Churchill?
No, Eisenhower.
Maybe.
It was Eisenhower, yeah. He's supposed
It implies a threat they can't do anything about. Specifically, they can't vote out of office. That's the thing that makes them go, okay, so then what? But to know the threat is actually to free up your mind to be able to navigate the real sources of the threat. And to not end up like those idiots in police mandated hotel quarantines in South Australia. You know what I mean?
Yeah.
If they can,
Woodrow
they believe themselves in a bind, but there is a way out of it. It's Wilson.
Woodrow Wilson. I just looked it up.
He was in a position to know.
Since I entered politics, I have chiefly had men's views confided to me privately. Some of the biggest men in the United States in the field of commerce and manufacture are afraid of somebody, afraid of something. They know that there's a power somewhere so organized, so subtle, so watchful, so interlocked, so complete, so pervasive that they had better not speak above their breath when they speak in condemnation of it. That was in his book, The New Freedom, 1913. That's the kind of thing I was talking about. That it opens up, that idea to the average person that this might be the case, and then what is any member of the public, ordinary member of the public, going to do about a power so organized, so subtle, so watchful, so interlocked, so complete, so pervasive that you better not speak above your breath when you speak in condemnation of it. You can take it for what it is, from Woodrow Wilson, but it kind of fits. For me, it fits when you look at this situation. I don't necessarily mean necessarily that it's all about some conspiring cabal sitting in a back room planning all this or whatever, but that there is some kind of an influence, a mass mind influence or something that's impacting society right now that is pretty fearsome, and when people get a view of it, that they really do get the impression that this is something I can't do anything about. It's
I can
not something you
empathize
can change.
with the impulse to flee it, flee
to flee into
realization.
denial and
Yeah.
take the easy way out and believe the comfortable narrative.
Yeah.
It's easier.
It is important to empathize with those people because a lot of others out there are getting angry. Say they're relatively new to this realization themselves. Well, they're turning on those they still see as problematic and authoritarian and so on, and directing their anger at them. I mean, all kinds of tweets about how, you can see how that leads into a civil war type situation where it's neighbor against neighbor, family member against family member. But the correct response is actually empathy for them. And at the same time, maintaining healthy boundaries from them.
Yeah.
There were no major protests around the world in the last 3-4 days. Brussels also yesterday. Tel Aviv. Every week there's protests every weekend in Tel Aviv for the remaining minority. There is a clear minority, but they're consistently protesting in Tel Aviv. Big one in Vancouver. I think in part there it's inspired by similar moves in Europe and the United States. Mandatory vaccines for healthcare workers. They're like, no, we don't want that. Athens, same thing. Mandatory vaccines for healthcare workers inspired protests in Athens. Big ones, much bigger than in the English-speaking world. There's some video footage, but I don't see any follow-ups on it, of truckers starting to block highways in Australia.
Yep.
That'll be one to watch. And a funny one, I don't know if we want to watch it because they're not speaking in English, but protesters wearing yellow vests stormed a live news broadcast on Slovenian state channel to demand that the newscasters stop reading that shit off the teleprompter and instead please report. In fact, I think maybe Scotty knows what they said. He might have a...
You have to translate for Scotty.
Okay.
Here it is. I think the gist of it was they just said, stop reading that shit on the teleprompter and you're going to start reporting what we want to see
That'd be
here.
awesome if they could do that.
It's not the first time people have tried to storm TV studios.
No. And the police?
Police coming in behind them to get them out. There they are in the yellow vest.
Boste mogli uporabiti silo nad ljubimi ljudmi, ki tukaj 3 mesece čakamo za sestanek.
Pa sodelovali v genocidu nad Slovenci.
Boste
I wonder if it was a broadcast.
boste šli na naš narod.
I wonder if it was live. You know?
Maybe not.
It would have been cool if it was live, you know?
But that is my dream, actually. I'm looking forward to seeing. I have this, like, it's on my wish list. Someone is in the middle of a live broadcast, and somebody else, their protesters, come in and either demand that they say this, or
Yeah.
just simply push them out of the chair and say, sorry. So here's the actual state of play out there, people.
Martina on the chat can translate for us, she said. Probably the description is more or less what they said it was.
As protesters everywhere are saying, the media is the virus.
It sure is.
I want to show up something. Can you pull up the two Toronto Star headlines from last week? Headlines, and they're the cover images. So this is the first one. I think it's from early last week.
Yeah.
Toronto Star in Canada. I think they've done this montage where they're either for real or descriptively summarizing and citing your authoritarian viewpoint on this. I have no empathy for the willfully unvaccinated. Let them die. And that sentiment is shared by a lot of such people. Okay, that's several days prior. This is Toronto Star yesterday.
Yeah, I don't know. Why is there... Maybe, look at your own newspaper? Maybe, I don't know.
Let them die. What's wrong with you people?
Why
Let
is
them
everyone so
die.
angry? That's journalism right there today. Journalism today. What are you going to do about it? Well, you got to...
Well, in Slovenia, they have a good idea. Take it over.
Yeah.
Or ignore them. Ignore them if you can. Do what we do. Try and read through what they're saying to get a real read on the situation. You can still do that. No matter what they say, no matter what they pull, no matter where the narrative shift, they're always telling you other things by what they're leaving out.
Right.
And by what they're trying to get you to focus on at any given time. Timing is important.
Mm-hmm.
Look at the return this week of the spate in stabby jihadi attacks.
Yeah.
New Zealand
Right.
extends a lockdown, and then lo and behold, there's a stabby jihadi incident.
Yeah.
First time since Christchurch, which of course evokes memories of the Christchurch massacre. Jacinda gets up there. I can't even do her accent. It's so terrible. Awful Kiwi accents. No offense to good Kiwis out there, but I can't stand that woman's voice. But she gets up and she gets the messaging of, isn't this awful, despicable a terror attack?
Yeah.
Well, that's the first thing, labeling it a terror attack. I mean,
Right.
he stabs a few people in a shopping mall.
Yeah.
Okay,
ISIS inspired.
That happens all the time.
ISIS
but
inspired.
they get the headline right. We know he was ISIS inspired.
Well, we were following him
We're calling it a
24/7.
terror attack.
Yeah. They were following him all the way.
They knew him for 5 years. They blocked his exit from the country because they suspected he was trying to get into Syria to fight for ISIS in 2016. They knew him so well, they were tracking his movements from his home to the shopping mall in New Lynn in northern New Zealand. They had armed police on the scene, couldn't intervene quite soon enough. He got to stab 6 people, 3 are in critical condition. Then they shot him dead. Case closed. But whatever about the details of that, it's just a bizarre synchronicity of ISIS, in quotes, and the kind of the use of emergency powers by the state. That's one example. Breaking news today, I don't have any follow-up on it, but that is another stabby jihadi incident has taken place in Berlin. The third, they're just 2 incidents. Did I send you the Bloomberg link about the Swiss report? let's have a look at this. This is reported not in connection with any of these incidents. August 29th, so a week ago, Switzerland warns of terror attacks on vaccine sites. So you're like, well, okay, that's presumably people who are strongly enough against vaccination sites that they're willing to engage in sabotage and acts of violence at vaccine centers. But no, the Swiss Federal Intelligence Service is warning of potential terror attacks on vaccine sites. And scroll down a bit to see who they have in mind for doing this.
Attacks on such targets would both hit large crowds and generate intensive media coverage.
Swiss intelligence is concerned about attacks from jihadist groups. So the implied merging of narratives here would be that ISIS is going to now intervene on the part of people who are against what's happening on the vaccination. And they would... commit terrorist attacks.
That second paragraph
sites.
and show there, Scotty, just highlight that last part. No, the third paragraph down. Then that's a Swiss intelligence concerned about attacks from jihadist groups, the newspapers reported. So far, there are no tangible indications of planned attacks.
I know. So you're like, did they just pull that out of their asses? Well,
It's kind of like COVID,
sort of. You see, the factual reality is there have been 22 vandalizations up to including the very careful destruction of vaccine stocks at vaccination sites in France in July and August. 22 at the last count that I'm aware of across the country. People have gone in at night and either, one of them was clever. They didn't quite set a fire and burn the whole place down. They set enough of a fire to turn off the sprinklers,
right,
which flooded the place and it could no longer be used. And in another place, they vandalized with graffiti. And in the third place still, that I know of, they went in and actively destroyed the stocks. They broke open the cases holding the Pfizer and Moderna vaccines and damaged them only.
Yeah.
Another one, it was an arson attack and they did try to burn it down. So that's actually what's ongoing. And then you've got an intelligence service coming in as if off stage left and you've got a merging of terror narratives.
Yeah, yeah.
You know,
well, it's not surprising that they would do that.
So that might be something to...
They made a lot of hay out of the terrorism business over the past 20 years, so I'm not surprised they'd be merging the two. And it's an interesting connection to make between the two, as if it suggests a kind of a common source between terrorism and COVID measures. Interesting. Anyway, yeah. Do we have anything more?
Do we want to say something briefly on the extreme weather event, the US Northeast last week?
Yeah, people need to watch out for the weather. It'll blow you away.
It'll blow you away.
It'll flood you out. It'll drown you basically. No, it's crazy. Yeah,
it's
super
crazy.
People have to start paying attention to that as well.
On the face of it, there was no reason to, because it's commonly known that when the remnants of an Atlantic volcano hurricane make their way through land in the United States, they're relatively tepid by the time they hit New York, New Jersey, Pennsylvania, the northeast of the country. But they were completely blindsided.
40-some people
killed. It reminds me of what happened in Germany in July. The extent of the flooding.
Yeah.
Another factor.
Except this was in relatively flat New York City and Manhattan. You know what I mean? And across the northeast of the US in different places. But in New York, it was just a torrential downpour and it just didn't stop, and it just flooded basements. There was 40-some people killed as a result of the flooding. I mean, various different reasons, but some.
Oh no, the death toll's up today.
Is it up today?
The death toll is now 64 and rising. I don't think they have a full picture of what happened.
Maybe not. But there
were at least a dozen large tornadoes on the approach to the major cities, urban centers. So that's something that has an extra. Indeed, it followed the pattern. The hurricane speed winds are slower as they come through land in the United States. But what should not have happened is the volumes of rainfall, because they didn't have a warm sea over which to accumulate that rainfall mass, according to the traditional models, which is why they were blindsided. Yeah. They didn't. This isn't totally different to, say, the hurricane that hit. Oh, I forgot the name, but the big ones, for example, in recent years, Katrina They knew in New Orleans, they were watching that coming in. They knew it would be bad. Similarly with the one in New York and New Jersey in Halloween several years ago. Sandy knew it would be, had good prep. Everyone was psyched for it. This, they were totally blindsided because where on earth is it accumulating that extra moisture to flood basements in New York?
Yeah.
You know, it was horrific. I think 22 people were killed because they couldn't get out of their basement apartment. But another 22 people plus were killed by the tornadoes directly. Extremely destructive tornadoes. Where does that energy come from? It doesn't follow the normal modeling of a waning hurricane system.
You don't often hear of tornadoes in the vicinity of New York or even New York State. It's not a very common thing to happen, you know. And obviously it coincided with the remnants of that Hurricane Ida, you know. So people should look at our monthly Earth changes video. We do a roundup of monthly Earth changes. We call them Earth changes, but it's just basically crazy wild weather around the world over the previous month. And we just released one there a few days ago for the month of August. And you should just take a look at it. And there's loads of different events in it, but the one that dominates and has been dominating for months and months now is rain. Massive amounts of rainfall across the world. And the implication of that is that if that continues, it's going to eventually probably impact food production. When you have that level of across the world of extreme change in climate, basically in terms of what people expect and for one season compared to another, you're not getting that anymore. And it's going to affect food production at some point. And it'll happen... You know, there'll be a lag basically, but it's going to affect it in one way or another, and people should watch out for it. You know,
the most extraordinary thing about the volume of rain that fell in the U.S. Northeast on Thursday isn't the high death toll, or the fact that multiple tornadoes killed the same numbers of people again. It's the fact that the region's rainfall records for 1 hour volume. That's, you know, the intensity a deluge can punch, and the over the 24-hour cumulative falls, which is what decides whether or not there'll be flash flooding and the sudden rise in rivers. Those records were broken in that region on Thursday. Those records from many sites, it's not completely ubiquitous to the region. Those records were 10 days old. Mm-hmm. They were set 10 days prior. Can you pull it up, Scotty? We have it on set. When Storm Henry, was it the remnants of another Hurricane Henry? Storm Henry
came in from the Atlantic.
Gives New York City its rainiest hour in recorded history.
That was
on August 22nd.
Right. So 10 days later.
Henry dropped record-breaking rainfall for New York City. It only survived 10 days. That's what I'm talking about. It's the intensity of increasing cascading events.
Back to back,
yeah. Another one before we sign off on that. Colorado shatters its record for flash flood warnings in a single year. So it's a cumulative thing for 2021. 2021 is only 8 months old. Colorado has had 3 times as many flash flood warnings in a single year than its average number. Mm. So again, you've got long-term cumulative changes, and in the short-term local effects, cascading increases week on week. Mm-hmm. I mean, this is like...
But isn't that all our fault, though? The climate change?
And if you're to believe the British government, who's messaging for the upcoming climate change conference, yes, indeed, it's people's fault.
Do we need to lock down to save the planet? To stop climate change, I mean?
What, we'll all be locked down in our basements while the floodwaters rise? That's what they'd love, isn't it?
Yeah. Lock in your basement and whenever the floods come. Seems legit to me. Anyway, so things be crazy out there, you know. It's pretty mad. It's hard to keep track of it. It's hard to rationalize it, you know, and I think it's going to get harder and harder to rationalize it and to make sense of it, you know. I know a lot of people are just giving up trying to make sense of it, and they're just carrying along, and they're just doing the la 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 la, everything's fine, just carry on, whatever, just keep my head down. But I don't think it's going to be possible to keep your head down for forever, you know. Things are going to intrude in such a way on people's lives that you're going to have to sit up and take notice, and when you sit up and take notice, you're going to have to be able to deal with it, you know. So it's probably better that you don't keep your head in the sand in that respect until something comes along that really blows your head out of the sand because you're going to be unprepared for it. So you really should. There's a lot of benefit to actually, even though it's difficult, to paying attention, continuing to pay attention to what's going on, and continuing trying to figure it out, and seeing behind the scenes basically, and seeing behind the headlines like we've just been doing, looking, reading beyond the headlines, and doing your own research, and looking at, looking for a deeper truth, or not even a deeper truth, a more objective truth than the media tends to portray, because as we've just shown, the media definitely does have an agenda. The media is very closely associated with government in terms of government messaging, no more so in the moment or in the period of a crisis. When the government announces a crisis, then the mainstream media is absolutely required and very willing to get on board with government messaging. They basically become a spokesperson for government, and it's all for the public good. So people need to understand that, and the reason you would look behind that and not accept that simply as it is because, well, you need to have a healthy level of skepticism about government policies and intentions and what their purpose is, and that don't simply accept all the time that it's for the public good. That's way too naive. It's not reflective of very normal, common human nature. You don't have to go into kind of psychopathology or any kind of pathology. It's just even normal human behavior. People in your own life, or throughout your life, experience you've had with people who, have hidden agendas and are up to no good and in it for themselves. You have to be able to allow that to be a reality among politicians and people in position of power. In fact, the argument is that there's a reasonable argument that you should allow that even more so for people in those positions, because the old adage of power corrupts and absolute power corrupts absolutely, it should be taken seriously, like not applied across the board, but taken seriously. So you need to look behind. By definition, you need to look beyond the headlines, because that's simply coming from the government. The media is simply repeating government mantras to you, and we're suggesting that governments, there's a good chance, given depending on the situation, that governments don't always have your best interest at heart. They're not interested in you as an individual. Governments look at the population of any given country, say in France or the UK, 65, 70 million people, in the US 300 million people. Do you think any government official feels for each of those 300 million people or each of those 70 million people, has a personal relationship with you and thinks about your welfare? They see you as a morass, as a rabble basically, that is to be controlled. And they'll control you in whatever way they see fit. Now, if you don't want to be controlled, then you're going to have to sit up and take notice and look beyond what governments say, because their goal in their messaging is always to, in one way or another, control you. If you don't like being controlled, you gotta take back control yourself and make decisions for yourself. And that starts with thinking and, researching and making decisions for yourself. So on that basis, it's not rocket science, but it's very hard for a lot of people. And I suppose, like you said, we have to have empathy for them and stuff, because most people out there are just trying to get on with their lives and live life as best they can. But you got to be careful as well for the Karens and the Darrens. You can't be naive yourself.
Yeah. Empathize with them, but the harsh reality, and if harsh is even the right way, from one perspective it is harsh, but evolutionarily speaking, as they're fond of pulling out themselves, reality, it seems to be saying to each of us as a group, individually, that the sine qua non necessity for entering the new reality, the new normal, whichever form it takes, is that you must question authority. There'll be no room for followers.
Yeah.
At least not to the blind extent.
Yeah.
That most people are used to.
Yeah. Those people are get used and abused, basically, they're in a dangerous position. Anyway, we'll see how it goes. We'll be charting. Whatever happens, we'll be charting it as it goes, whichever direction it goes. Pretty sure it's not going to be up. It's at the very least going to be on a
south,
somewhat downward slope. Could be precipitous, could not. Maybe precipitous at a certain point. But we'll keep tracking it and keep you all updated on what we think is going on anyway, as long as we're allowed to stay here and have our say. So yeah, thanks for watching. Thanks for listening, liking. Thanks for commenters. Thanks for chatters. Subscribe, all that stuff. What did somebody say last week? Push all the buttons. Do all that stuff.
Buttons.
Do all that stuff. Push all the buttons at once. So yeah, we'll be back next week. So have a good one. Stay safe.
Bye, everyone. Thanks for listening.
Can't stop the signal now.